Good afternoon. I'm Mike Larris of the Annie E. Casey Foundation. We're delighted to have so many people come out for this presentation and conversation, Tackling Poverty, the Role of State and Local Governments, which is co-sponsored by the National League of Cities, Half in 10, and Spotlight on Poverty and Opportunity. Less than a year ago, the Casey Foundation and several other funders partnered to start Spotlight on Poverty and Opportunity to draw attention to and build public will for concerted action on poverty and prosperity for all. The only reason Jody asked me to moderate this afternoon's session is because Brad Pitt couldn't make it. Jody argues that Brad's work in New Orleans around poverty and merited a seat at this table. I think she had some other motivations, but he's tied up with the Twins, so you get me. Spotlight is going to New Orleans in September, and why Brad won't be joining us again. Angela has a restraining order against Jody now. We're keeping our fingers that we'll get to collaborate again with Half in 10 and with John Edwards, who will help us zero in on what the next president can do for the Gulf recovery. While the three organizations come together today to sponsor this event, many other folks in the room have been working long and hard on these issues as well. Today's event helps to crystallize that poverty and opportunity have come politically of age. In our two panels, we will offer first a quick overview of what a few national organizations have underway, quick glimpse of developments around the country. Then our second panel will have a chance to hear in more depth answers to questions about specific state and local actions. I'm not going to introduce each of the panelists because you have their bios in your folders. I will, however, close with two quick quotes from our presumptive presidential candidates. McCain: "I will make the eradication of poverty a top priority of the McCain administration. A strong and vibrant America, one in which people can move up into the middle class, put their kids through college, work hard, and one day retire in dignity, is critical not only to our economic future, but to the very security of our nation." Obama: "I will absolutely make a commitment to cut poverty in half in a decade. Understand that when I make this commitment, I do it with great humility because it is a very ambitious goal. And we're going to have to mobilize our society not just to cut poverty, but to prevent more people from slipping into poverty." There are a few political pundits who a year ago would have predicted these public commitments from the presidential candidates. Today, we have a chance to learn about the steps being taken to make this moment not just a moment, but a movement. Speaking of moments, each of the national panelists has 5 minutes, 300 seconds to tell their stories. Let's get started so we'll have time for some questions and answers following. Folks, Joy. Joy will start off.
Okay. Good afternoon. It's, again, great to see so many people come out today for such an important cause. My name is Joy Moses, and I represent the Center for American Progress Action Fund, as well as the Half in 10 campaign. So I'm just going to give you a little bit of background on who we are. In the aftermath of Hurricane Katrina, the Center for American Progress Action Fund decided to spend some more time and devote more energy to the issue of poverty. And in doing so, it formed a task force that was given the very important goal of trying to find some solutions to this very important problem. It ultimately produced a report that did a couple of things. The first thing it did was it said that we should set a national goal of cutting poverty in half in 10 years and to completely eradicate it within a lifetime or 30 years. So that was one of the first important things, and we thought that that was a good way to set a nice yardstick on measuring our achievement and our progress toward achieving the goal, and it was also a way to establish the importance and the relevance of the issue itself. The other thing it did was, the other thing that the report did was set out 12 policy recommendations for how we could achieve that goal. Those policy recommendations are diverse. They encompass a number of issues that involve increasing incomes, housing, financial services, even prisoner reentry. So we were starting with in that place, and we decided to get some expert opinions and views about how well these actual recommendations would do in achieving the goal of ending poverty. And what we found was that just 4 of our recommendations, expanding the earned income tax credit, expanding the child tax credit, expanding access to child care, and increasing the minimum wage would reduce poverty by 26%. So we were pretty sure that we were headed in the right direction, and we had a solid policy plan. So the next thing we needed to do was find a way to put it into action. And that's where Half in 10 was born. Half in 10 is a campaign that has 4 partner groups. One of them is the Center for American Progress Action Fund that has a heavy focus on policy development as well as effectively communicating our policy ideas. Other groups include the Leadership Conference on Civil Rights and the Coalition on Human Needs, 2 groups that have vast networks of various organizations. There are umbrella groups that have grassroots networks as well as a very strong presence in the national policy realm and do a fair amount of lobbying up on the Hill. And the 4th group, although definitely not the least of the groups, is ACORN, which also has a strong grassroots focus that is linked to a lot of the things that the Poverty Task Force that CAP had initiated were concerned about. So when our 4 groups were in place, we did decide, as was mentioned earlier by Mike Laracy, to invite Senator John Edwards to chair our campaign, and he graciously agreed to do it, which was a big plus for us in helping to raise the profile of our organization. And then we added another piece. We developed a system or a connection between a number of different allied groups. These were groups that are focused on poverty in the same way that we are, or are focused on different issues that come under the umbrella that we were concerned about. And they represent a broad range of groups, from labor to racial justice groups, gender equity groups, faith-based organizations, and we are bringing them under the umbrella and creating a vast, network of folks concerned with these issues. So we've initially decided to focus on 4 issue areas, those being the ones that I mentioned earlier that we know reduce poverty, the earned income tax credit, child tax credit, minimum wage, and child care. But we wanted to be a dynamic group as well and be responsive to what's actually going on in the country right now. So as a result, we've had some focus on unemployment insurance, which is, I'm sure we can all understand why that's important right now during this bad economy, and predatory lending as it relates to the mortgage crisis. One of the reasons that we're here on this panel is that we've had a strong emphasis on building the connections between state and local governments and grassroots organizations, and that's something that Senator John Edwards has spent a lot of time with thus far, visiting various cities, meeting with mayors, meeting with state legislators, and bringing them together in large roundtables and large community meetings with grassroots advocates so that folks could jointly discuss the problems and jointly think about solutions and build bridges there. So that's a little bit about Half in 10, and I'm sure if there's some questions about it in the aftermath, I can, and I shouldn't say aftermath because it's not a negative thing that my fellow panelists will be bringing forth, but I'll be happy to answer questions later. Thank you.
Thank you, Joy. Susan?
Hi, I'm Susan Galanka. I'm the Program Director for Human Services at the National Governors Association Center for Best Practices. And, I think we can say that governors have been involved in promoting issues and policies that address poverty for years. And I think when you think of the list that Joy just gave out, some of the priorities, state earned income tax credits, for example, state minimum wage legislation, health insurance coverage, early childhood education, access to child care, and more. But I think what's different now is that states are actually using the word poverty, and they're engaging in efforts that look comprehensively across the many policy domains that actually impact child poverty, family poverty, and really poverty for all individuals. Around the country, we're seeing commissions started. I think we have about 10. 5 states have specific poverty reduction targets. All of these things you'll be hearing more about later. So in response to this growing interest, the NGA Center for Best Practices has undertaken several efforts that confirm in an attempt to assist states as they address and tackle poverty. And we're actually building ourselves upon a body of work that has been underway for 5, 6, 7 years, what we called our Family Economic Success Agenda, where we looked at issues around access to work supports, access to education and training for low-wage and low-skilled individuals, and we published issue briefs, held meetings, etc. Last fall, with the National Conference of State Legislatures, we held an Institute for State Policymakers on tackling poverty and promoting family economic opportunity. And we were very pleasantly surprised that more than 20 states applied to participate, although we had to accept about half of them. And each state sent representatives from their executive branch and legislative branch, and heard from lots of experts, and as in small teams, came up with some ideas and strategies that they hope to employ when they got back home. Our newest effort, and one that we are just now launching, is our Governor's Summits on Poverty and Economic Opportunity. Hopefully at the end of this week, we'll be issuing a request for proposals where we will be able to select up to 10 states to receive a small grant, $12,000, to assist in their planning and conducting a Governor's Summit on Poverty. The goals of this initiative include providing governors and legislators with a springboard for state and local action on poverty. We want to educate and engage new leaders and stakeholders in the effort. And while outcomes will vary certainly by state, we hope that we might see as a result the development of statewide comprehensive plans or sets of recommendations to reduce poverty, the creation of ongoing commissions on poverty, task forces, or other processes to guide future work, development of recommendations for inclusion in governor's budget and legislative proposals, as well as the formation of hopefully ongoing new public and private partnerships that will really sustain this agenda and this interest. The NGA Center for Best Practices will also be providing technical assistance to the states in planning the summit, identifying policies and practices, and helping them with their post-summit action plans. As I said earlier, we hope to issue the RFP by the end of this week, and so I would encourage you to encourage your governor's office and your state executive agencies and your stakeholders as well in your states to encourage the governor's office to apply. And one thing I think is interesting, what we're trying to do also is broaden the interest in this issue. And so while we're calling these governor's summits on poverty and economic opportunity, it will really be up to the state to frame the issue, to set the name for it, if you will. In the past, states have done similar summits where they called it Summit on the Quality of Life in a State or Bridges to the Middle Class. We want to make this issue as inclusive as possible, and so in that way we will really be encouraging states and governors as they apply to think about how will this issue resonate in the state, what is our starting point as we go forward. We're excited about this effort and of course a little bit anxious as well. We hope we get dozens of applications, and we look forward really to seeing what will happen as states continue to focus on this issue of poverty, reducing poverty in a comprehensive and holistic way. Thank you.
Thank you very much. Jody will now talk a little bit more about Brad Pitt's role in poverty reduction. No.
Delighted. That'd be a great deal of fun. I'm Jody Levin-Epstein, Deputy Director of the Center for Law and Social Policy, CLASP, and I help manage the funder-led initiative Spotlight on Poverty and Opportunity. I'm not going to say much about Spotlight except www.spotlightonpoverty.org. If you've not already signed up to get the weekly egrams, it's easy to do, and it's essential if you want to stay up to date on the latest news from around the country on what's happening in this issue area. And when you're there, check out the commentary so that you can hear the latest from political figures such as Speaker Newt Gingrich and Speaker Nancy Pelosi. They're up with their own ideas. Spotlight could say, hey, mission accomplished, since both presumptive presidential nominees have already made public commitments in this issue area, but we're not going to rest comfortable at all. We're going to move forward now to build a big tent for the long haul to get results. Spotlight and CLASP released a report in April. And from the report, there are 5 top takeaways I want to highlight. And Mike Larissy has kindly agreed not to be Brad Pitt, but to be my Vanna White for the day, to reveal each one. So thanks very much, Mike. Number 5. Well done, Mike. Number 5, trend. Can everyone see this? Maybe you need to move it out a little bit. Because you've got some folks that can't see. Okay. Number 5, trend. We are at a political turning point. Opportunity for all is gaining salience. Numerous states have established visible venues through commissions, new legislative caucuses, summits, and/or poverty reduction targets. Poverty and opportunity have been invisible, buried politically for many years. Senator Daschle tells an illustrative story. It's about the late Senator Paul Wellstone, who decided in 1997 to revisit the places Bobby Kennedy had been when he took a poverty tour 30 years earlier. When Wellstone, one of the mightiest progressive senators, informed his staff of this idea, a staffer piped up, "Senator, we don't talk about poverty." As Daschle notes, Wellstone went forward with his tour, and he talked. Number 4, Mike. 20. How big a trend? In the April report, we found that 12 states had taken action to raise the political profile of poverty and opportunity, again, through a commission, a new legislative caucus, summit, or poverty reduction target. Remarkably, almost all 10 of these initiatives were launched just since 2006. I hope you picked up a copy of the April report. No more will be printed. That's because it's woefully out of date. The most exciting news is that an additional 6 states have acted just since April. So today we have at least 18 states that have acted. We expect to release an update by the end of August. We are clearly inching towards 20. Mike, number 3, targets. Are you there yet, Mike?
I'm there.
All right. There we go. 8 of these 18 states have set some kind of poverty reduction target. A target includes both a numerical goal and a timeline for getting there. For example, a 50% reduction over a decade. Half in 10. Kind of a ring to it, Joy, don't you think? A branding opportunity, half in 10. Among the choices in setting a target is which population to focus on. Could be the overall population, just children, extreme poverty. The states with targets are Connecticut, Delaware, Illinois, soon to be signed, and Amy will discuss, Louisiana, Maine, Minnesota, Oregon, and Vermont. A 9th state, California, has a bill pending. Poverty reduction targets are not unique to the U.S. While you may have heard about the child poverty reduction target in the UK, poverty targets are underway or under consideration in other developed nations, such as Austria, Belgium, and Canada. A class paper will be forthcoming. Targets are not unique to poverty reduction. Targets are part of a trend in governance. A range of other social endeavors are increasingly assigned targets. For example, targets are being applied to environmental goals. And eliminating chronic homelessness in a decade was asserted in President Bush's fiscal year 2003 budget. Targets are tools. You have to work with them. Just setting the target does not get there. But when they're effective, they have 4 virtues. They're shared, it's a common vision, they're simple, everyone understands them, from the politician to the media reporter. They're silo busting. It requires agencies to work together, and they're solution building. We've got 2 more numbers. We're going to run through them really quickly, Mike. Number 2, tent. The new trend is emerging along with the potential for new politics, too. A big tent approach to opportunity for all, not owned by one party or the other. Just listen to the words of Jim McLaughlin, a Republican political consultant who has a commentary up on Spotlight, where he states, and I quote, "I work with and for conservatives and Republicans, and I've come to perhaps a surprising conclusion. Taking on the fight against poverty is not only the right thing to do, it's a politically pretty powerful message for conservative Republicans." And last but not least, number one, time. Whatever has caused this trend, increase in economic disparity, a dwindling middle class, globalization, this is, as Mike said, a moment in need of a movement. One that will build commitment and require both action and accountability, a movement that will sustain over time, that will deal with the immediate and pressing issues like the recession, like the very definition of poverty, but will not allow those issues to deflect from the need to build upon this moment now. It is, after all, not just the right thing to do, but what is needed to keep our nation's engine competitive in the global marketplace. Time will tell. Thank you.
Thank you very much. Cliff.
Thank you, Mike. I'm Cliff Johnson, the Executive Director of the Institute for Youth Education and Families at the National League of Cities. I want to thank the sponsors or co-sponsors so much for doing this today. And I want to begin with something that you already know, which is that city leaders many city leaders understand, that persistent poverty is a threat to the quality of life and to the economic vitality of their communities. It is because of this understanding that the National League of Cities, both through its Institute for Youth Education and Families and through its Center on Municipal Programs and Resources, is engaged in multiple ways to try and help city leaders address the poverty, tackle poverty in their communities. I'll skip the commercial, but I do want to make sure you're aware of a variety of resources that are available through NLC, all of them on our website. We, this past summer, did some canvassing of cities across the country looking for new anti-poverty initiatives. We captured the most interesting of those in something called Combating Poverty, very short, accessible set of profiles. We have a city practices database at the National League of Cities that includes also some additional profiles on taking action to address poverty. And there are also some very deep case studies that have been produced by Phyllis Ferdell and her colleagues in the Center on Municipal Programs and Resources under our Building Equitable Communities initiatives. And those case studies and profiles are in a much larger volume, also on the website for NLC, but also available through hard copy. So there's a great deal of activity going on in NLC through our Institute for Youth Education and Families. We're very focused on providing practical help and advice to municipal leaders on specific policy changes and program initiatives they can undertake to make a difference. You're going to hear a very exciting example of that with what's going on in New York City, of course the nation's largest city. But it's also fascinating from our perspective to see cities of all sizes taking on the poverty issue and finding different ways to make a difference. Through our institute, we're spending a lot of time on practical things like EITC outreach campaigns, multi-benefit outreach efforts to connect parents and families to other benefits, food stamps, Medicaid, et cetera, that they may be eligible for to help boost their incomes. We've been very active in transitional jobs work and see transitional jobs as a key strategy for increasing the capacity of residents to earn and support their families. We're now in the midst of a lot of asset building work, including a Bank on Cities campaign that seeks to make sure that low-income residents are connected to mainstream financial institutions and can use that as a way of bolstering their long-term family economic success. And so in each of these areas, we can point to many, many communities of varying sizes that are taking action, that are involved in making a difference. At the same time, there's a much larger set of conversations that are going on at the city level, at communities of all sizes, that are less focused on policy change, at least initially, and much more focused on discussions about disparities in income in their communities, visions of what it would require to move to a more equitable community, if you will, and also a focus on the process of having conversations that bring very diverse stakeholders together across the community to take action to address the poverty issue. And so that work continues in a variety of ways. We have a peer network that's very active right now that's pulling folks from various cities together for quarterly conference calls. Through the Building Equitable Communities initiative, we also are doing a series of roundtables. The third of a series of 3 will happen next month, and we'll bring together folks from Nashville, Norfolk, and East Orange, New Jersey, to continue their work to try and tackle the poverty challenge and build more equitable communities. So there's a great deal of energy at the city level. And I would just leave you with one last thought on that front, which is that I think it's very important to focus on national and federal policy. It's very important to focus on state policy as key levers. A lot of, in a number of cities that we see, some of the response and reaction that's coming from the city level is precisely because of the growing frustration, the pent-up frustration about the lack of leadership, particularly at the federal or national level on this issue. At the same time, what we know about poverty reduction, about tackling poverty, is that it requires a blending of income supports and service strategies to make it happen. And that a lot of that work really does has to happen at the city level. Folks need the tools to work with, but you need city level leadership to make a difference, and so we hope to be a part of that. Thanks very much.
Thank you, Cliff. We now have about 10-15 minutes for questions and answers, so let me take questions from the floor. Who wants to ask the first question? Okay.
Hi. Hi, I'm Sharon Levin from Washington Area Women's Foundation, and I was curious, I think we all know that the majority of adults living in poverty are women, and the majority of children living in poverty are living in female-headed single-parent households. And I was wondering if any of the programs you guys have been looking at or talking about are specifically designed for or targeted at women.
Anyone want to take that?
Well, I can speak from the point of view of the Center for American Progress. We have been very aware of that dynamic, and we're currently working on a report that's focused on women in poverty and developing policy solutions for the specific issues that impact women and their families. And that's possibly going to inform the work of the Half and 10 campaign as well. So it is definitely on the radar screen.
In specific states, but often if there's a commission, there'll be a layer of the work which is collecting data and demographic information, and oftentimes the reports will include that lens and at least offer up the information and insights you've just described.
I think at the National Governors Association, our work that we have done around welfare reform and TANF and helping TANF recipients overcome barriers and progress has, because of the very nature of who's on the caseload, has focused on women.
I'll also note that some of the recommendations in the CAP task force report would be particularly helpful for female-headed households, such as the child care provisions, the child tax credit. Those provisions tend to be particularly helpful for low-income, single-headed households. Cliff, did you want to say something?
And just to underscore at the city level as well, I think there's a great deal of focus about the importance of reaching custodial parents, and so an awful lot of the outreach efforts that are underway focus on women, mothers.
Other questions? Yes, right there, in the middle.
Thank you. I'm curious on your Spotlight top 5 items. I don't see the word empowerment. I was wondering why.
Empowerment embraces them all. I'm just being flip, but I
What I think the important thing and our belief is that, as Mike had said in the outset, that this is a particular moment in time and it will not stick, and it needs to stick and become a movement, and it doesn't become a movement unless people feel empowered to participate in the process. So if that's what you mean, I think it underlies the success of the whole idea of a movement.
In back?
Okay, I'm Emily Noner with Bread for the World Institute, and I was wondering about the asset building component. When people talk about asset building campaigns, are VitaSite volunteer income tax assistance sites which provide free tax services part of that umbrella or that package, and how do we begin to expand that in state best practices?
So at the city level, they absolutely often are a linchpin for cities in terms of how they build EITC outreach campaigns and then move beyond the tax preparation opportunities to broader benefit screening packages and whatever. So the cities that are at the cutting edge of this work are using very sophisticated benefit screening tools that recognize that program administrators, tax preparers, et cetera, already have most of the information they need to screen for eligibility for other benefits and can give residents very accurate projections of what they're likely to qualify for so that they can make a judgment about whether it's worth spending the time to go through the application process. One of the goals down the road is actually to be able to directly apply for those benefits. That requires a level of state-city coordination that where we still typically have a ways to go.
Most of these state commissions are very young, and very few of them have yet to issue their recommendations. In the back of the report, we have a chart that indicates which recommendations are being offered by different state commissions that have gotten to that point. Some of them have already made recommendations in the area of assets and asset building. There is, in addition, a commission in Massachusetts which is entirely focused on asset building.
And just in terms of, there is a lot of state activity around, of course, promoting the EITC, and states are encouraging the use of VitaSites, but oftentimes there are not enough of them. And so some states are actually thinking of other ways that they can supplement VitaSites in terms of providing other tax preparation assistance.
I would add that Doug Nelson, my president, recently testified before a House committee on overhauling the way we measure poverty in the United States, and one of his recommendations was that we need complementary supplemental measures, not just of income poverty, which is what we're talking about primarily today, but also of asset poverty, persistent poverty, deep poverty. You know, it can't be the goal that you're trying to raise a family of 4 from 19,000 to 21,000, therefore they're out of poverty. You really have to have a series of much more nuanced, comprehensive measures of economic well-being, and certainly asset poverty is one of them. Other questions? In back here, and then I see you here.
Hi, Nicole Kibble. I'm interning at AARP, and I'm a student at the University of Wisconsin. I actually had an opposing question to the first one asked, and what kind of efforts are being made to engage fathers and men in reducing poverty, especially for children and families?
Well, certainly one of the most interesting ideas that are out there right now is to significantly increase the earned income tax benefit for childless workers, which is now, Mark, correct me if I'm wrong, like $300-400 nominal. And a lot of people, Charlie Rangel, Senator Obama, Mayor Bloomberg, Gordon Berlin at MDRC have proposed increasing the EITC for childless workers on the theory that it would help them enter the labor market, stay in the labor market, be more successful as fathers and spouses. So there's some interesting proposals, and I think that's certainly one of the most interesting right now. Folks?
I would just say one of the efforts that NGA has worked with a number of states on has been around prisoner reentry and helping returning prisoners as they return to their community and their families to be, first of all, develop skills and get training so they can secure employment, and then also to become a stronger part of their children's lives.
think at the city level, in addition to the kind of outreach more broadly that goes to parents of both genders, et cetera, I think there's an awareness that the child support issues here can often play a critical role. And that, again, speaks to some state-city coordination issues in many instances to figure out how to make sure that there are incentive structures in place that work all the way around.
I asked the first question, and I would just say also, I don't think that's an opposing question. I think it's a really important complementary question. Thank you.
I saw a hand here. Oh, there it is. Yes.
Brenda Ross, City of New York. Just a small nuance. A small nuance I think we all ought to consider when we're talking about bringing in the non-custodial parents is to stop referring to them as childless. It's small, but it sends a different message when you're dealing in public policy and you're lumping the fathers or mothers that are not. We all do it, and I think we should stop referring to them as childless adults and use the non-custodial parent.
Actually, distinction because in New York, correct me if I'm wrong, it is for non-custodial. There's a benefit right now. What the Rangel proposal would be for people who have no children whatsoever, as long as, you know, whether you're a non-custodial parent or childless. So there are two different proposals out there, and both are very interesting. The New York model is being studied by Ron Mincy, and of course the Rangel proposal is just still a proposal. Anyone else? Yeah.
Susan Reese from Wider Opportunities for Women.
Nice.
I wonder if you would address the issue of the extent to which pathways out of poverty through employment, besides welfare reform, what other employment, workforce development related strategies are being tried?
There's a number going on around the country. One area, for example, a number of states are developing what are called sectoral strategies, where they're looking at particular industry areas and developing sort of that are growth industries in their state where they foresee a demand for increased workforce demand. And so part of that is developing sort of a career pathway, if you will, or a career trajectory that begins with a low-wage, low-skilled worker as well as all workers along the way, the path and sort of giving them skills and training to advance at each level. Other states have been supporting scholarships for low-wage workers who can participate then in education training part-time, which is a big issue. And as you know, most of the federal and certainly a lot of the state funds available for post-secondary education has tended to be focused on full-time and generally younger students. So that's another area. I think state EITCs is another way where we're supporting advancement. And then childcare, again, another one, a lot of expansion around supporting childcare for low-income families, although that's still a challenge, probably not sufficient funds available there. So there's sort of a broad, I think, initiatives also around community colleges and career pathways around specific careers, often in collaboration between the workforce system and community colleges. So
I've been told we have 1 minute left, so one last question right here. I'm sorry.
Lucas from the Buffalo News. I'm wondering, for Mr. Johnson, has there been any effort to sort of look at the city of Buffalo, because it's one of the poorest in the nation in terms of large cities? Has there been any effort there to sort of work with city policymakers or on the state level to address that? And for the whole panel, I'm asking, the city of Buffalo, their median income is right above the poverty level, so that means basically about a quarter of the city is living right at poverty. Has there been any effort in the Western New York region to address that? Because I know there's been a lot of work in New York City, but Western New Yorkers feel like they've been sort of left out.
That's a good question.
So I'm well aware of the poverty issues in Buffalo, and you're right to flag them in terms of the place where Buffalo stands in the national whatever. We've not done any specific work in Buffalo on this issue.
As a graduate, not a
graduate. As someone who went to SUNY Buffalo for 2 years, I know of which you speak, and spent many a week, a day over in Lackawanna doing some tutoring and things like that. So I'm glad that you're raising this issue. The state of New York has a commission which it zeroes in on working poor families. To the degree to which it is going to pay attention and raise up the issue of those who are poor and unable to secure jobs or unable to work remains a question. So it's an interesting issue potentially to raise with respect to the focus of that commission. So I encourage you to ask and see what steps are going to be taken to ensure that the commission focuses broadly.
That's it. So while we bring the second panel up, let's thank our first panel.
Hi, everybody. My name is Mark Greenberg, and I direct the Poverty and Prosperity Program at Center for American Progress. And I'm very glad that we're having the session today and that y'all are here for the discussion. As you heard in the overview comments in the first session, there are a striking number of state and local initiatives now going on around the country. We couldn't have them all here today. So what we sought to do was to identify four, which can give at least a quick sense of the range of kinds of things going on. So we have one city, New York City, and 3 states, Minnesota, Connecticut, and Illinois. As you'll hear, they're all in different stages of their process, running somewhat of a gamut from New York City, where there has been a completed commission. There is now a Center for Economic Opportunity. There is a lot to talk about, as Veronica will in a moment, about what's in place around it, to, at the other end of the table, when Amy talks about Illinois, you will be hearing about an effort to get enacted a commission where the governor's signature is being awaited, and Minnesota and Connecticut somewhere between those two. So the structure that we're planning on for this part of the program is, for each of our speakers, I will begin by asking them a really broad, open-ended question, which they could spend a very long time answering, but instead they've only got 5 minutes to answer. So after they do that, and they will obviously have to be very selective and only touch upon things that they will want to talk about in much more detail in that 5 minutes, but after that 5 minutes, we'll follow up with me asking them a handful of additional questions for another 5 minutes, and then for each speaker in turn, it'll be possible for audience questions to the speaker for 5 minutes. If we're able to stay on schedule, that will leave us at the end roughly about 15 minutes or so for questions to everybody and opportunities for the speakers to interact with each other. So that's our envisioned sequence. So the more detailed bios for all the speakers are in the materials. But I will begin with Veronica White. Veronica is the director of the New York City Center for Economic Opportunity, and Veronica will have a large amount to talk about what it has accomplished so far. But Veronica, can you begin with your 5-minute overview of how did this come about, where are you, what's been accomplished so far?
At the beginning of Mayor Bloomberg's second term in office as mayor of New York City, he took a look at some of the issues of poverty facing residents, and it was actually a very good time economically for the most part in New York City, unlike the beginning of his first term, which was shortly after the events of 2001, when he took office in January of 2002. So he was able to start on a much better economic platform for the city as a whole, but still in all, in looking at the issue of poverty in New York, there was a clear recognition that many people in New York had been left behind. He appointed a commission led by Dick Parsons and Jeff Canada, and that commission of some 30 members met for 6 months with experts in the fields, with people across the country and with international experts as well, to discuss the issues of poverty in New York in terms of who is in poverty, what kinds of programs would help people get out of poverty, in terms of how do we measure poverty, and came back with a report that you can find on CEO's website, and I won't dwell on it. It's on the city's website in New York. That report, though, did suggest several things. One, with at least 1.5 million people in poverty in New York, it was suggested that the city think about focusing on certain target populations, and specifically recommended the 0 to 5s, the 16 to 24-year-olds, and the working poor. The commission also recommended that the city focus on certain communities or neighborhoods without suggesting what those communities or neighborhoods might be. And the commission very strongly suggested that each program should be piloted and every single program should have a strong evaluation component. And in addition, the mayor should think about how we measure poverty and create more nuanced ways of measuring poverty, and think about the fact that the existing federal poverty measure clearly didn't capture the issues, and clearly many of the programs that we would think about implementing would not at all affect the actual poverty measure, because it wouldn't affect the way the federal statistics are counted. So with that, that report came back in September of 2006. The mayor decided to set up some kind of a city agency in response to that, and I was hired in October of 2006 by the mayor, and I work at City Hall, have a very small staff, 12 people, but we have implemented 40 programs, working with 20 different city agencies for the target groups that I've just mentioned. So what we've done can be as broad as, for example, we set up a city child care tax credit. We already had a city earned income tax credit, and that child care tax credit that we had hoped would affect 49,000 people in its first year affected over 50,000 so far. People have taken advantage of it, approximately $530 per family that have taken advantage of that. That was one of the few programs that we set up, one of the only, I should say, that's universal. All of the other programs, for the most part, are targeted to specific communities. Each of the programs we've decided to locate in certain neighborhoods and start with small numbers. Many of the programs in New York City are operated through neighborhood-based groups. So, for example, to touch on the 16 to 24-year-olds briefly, with those programs we've set up a young adult internship program with many community-based groups. We targeted in specific 3 communities, Melrose in the Bronx, Jamaica in Queens, and Bedford-Stuyvesant in Brooklyn. But there are programs in various communities where the poverty rate is over 35%, which are approximately 13 community boards in New York City. Those programs, for example, for the young adults, there's approximately 165,000 youth in New York City that don't go to work, don't go to school every day. Clearly, we were not going to overnight craft a program for them. We had no idea what would work. This is a start. It's only impacting a few thousand people in its first year. We're studying its implementation by the different community groups. And what we did was we hired Westat and Metis, a team of evaluators, to look at all of the programs that we're doing, together with an internal staff, which is part of my staff, which is 5 internal program development and evaluation members. All of our programs will be evaluated with either MDRC or Westat and Metis. And in addition, we're looking at, and we've announced last week, several different new poverty measures. The first, based on the income adequacy approach, which is what the federal government uses, but instead of using 3 times food, we actually looked at the various costs involved, and instead of just looking at income in one way, we're looking at income in all the various ways that people do get income, and taking into account child care costs, transportation costs, and all the kind of costs that impact on people if they are trying to get to work. So we've just begun the work. It'll be 2 years in December, so it's about a year and a half into the work of the center. And we have, as I said, over 40 programs up and running, none of them impacting tremendous numbers of people, but each of them being evaluated, and each of them will give us a lot to be able to learn and to discuss and to think about whether it should be ramped up with city dollars or perhaps at the federal level.
Thanks. So Veronica, let's start just by talking about the commission a little bit. And first, could you just say a little bit more about what prompted Mayor Bloomberg? This was a surprise, at least to many people outside of New York City when it happened. What insight can you give us about that?
I think a part of it was that New York was doing so well at that particular moment in time. In January of '06, the city as a whole had recovered tremendously from the attacks of '01. Most people were on very good financial footing. The housing market had tremendously taken off. But of course, what did that do? It was leaving people behind, particularly in some of the communities which were then gentrifying. Housing costs were becoming so tough on moderate and lower income families. And in addition, the issues of poverty affecting healthcare, for example, and health issues in New York City amongst the lowest income populations were also weighing on the mayor. And he decided to take a look at it because it hadn't been something that had thought about, hadn't been something that we as a city had thought about in many years. And he was already putting a tremendous investment into our Department of Education, into a 5-borough economic development policy. But it was clear that these agency-led initiatives were not really going to conquer the problem. And that he wanted an effort at City Hall, and he wanted to have more data to look at and to think about what kinds of programs. And when he asked people, people would say, well, we've tried this, but that has never been evaluated. Well, we really don't know how many people in poverty because the poverty measure doesn't work. And so getting all of these kind of scrambled answers back, he's very much a person who wanted to look at the data issues, wanted to see what he could do during his second term to impact on those who are in the toughest spot in New York City, which is a very wealthy city.
And just following up quickly on that, how did his interest in the data issues spur the ultimate focus on getting an improved poverty measure?
Well, when we would talk about certain programs which we might utilize, for example, expanding an earned income tax credit in New York, when you think about that, it doesn't actually affect the poverty rate. So when you talk about getting bang for your buck, we would say to the mayor, well, we're considering this. And he would say, well, how many people will that affect that are in poverty? Well, it'll affect them, but it won't affect the poverty rate. It won't affect the poverty measure. So with respect to both sides of the equation, with respect to the thresholds, he found it pretty shocking that we were just using 3 times food as being a measure. And on the other side, in looking at resources, that we weren't really taking into account the kinds of the earned income tax credit, child care tax credits, the kinds of programs that we've been implementing at a city, state, and national level for many years, but really don't change the poverty rate, which meant that we can do all kinds of programs, we'd never really be able to evaluate whether they worked.
And certainly when the New York City information about the improved poverty measure came out, one of the headlines is it results in a measurement of more people being poor in New York City. And that's been suggested by some that was a brave thing to do. That's been suggested by others, well, gee, doesn't that just set up the case for more federal money for the city? So what was the context for that?
The context is to be able to measure what we're doing. It's very hard to have a poverty rate that really is not going to budge one way or the other, that is based on food costs and based on resources on the other side. We needed something that could really show whether what we're doing has any impacts whatsoever. So it's a policy measure to enable us to evaluate the programs that we're putting into place in New York City. And it's impossible to evaluate those programs if we really can't accurately assess how many people are in poverty. And also to be able to look at the neighborhoods and the issues, and is it more elderly or more immigrants, and those kinds of things that we're puzzling through right now based on the initial research that Dr. Mark Levitan, who's on my staff, led. So we're looking at the various populations, the various neighborhoods in New York City, and seeing what it is and where it is and what we can do about poverty, but without being able to actually know what communities and who's being impacted, we really wouldn't be able to assess at all whether our programs are working.
So when you talked about the work of the commission, one aspect was the targeting the 3 groups, the young children, 16 to 24, and working poor. Since we've only got a minute, why don't you pick any one of those groups and just tell us what are several of the programs that you're now implementing to try to address their situations?
One program, and the only one I know that works so far, is a nurse training program. So we created a nursing school at Kohler Goldwater Hospital on Roosevelt Island in New York City. And basically, there's only 39 people in the program, but it's a 1-year program, very intensive. They go to school from 9 to 5. We made sure that they had the resources in place from the government, be it food stamps or TANF or whatever they needed in order to be able to devote themselves to going to school for a year. And I just attended the graduation ceremonies 2 weeks ago, and all 39 made it through. And so I actually know that these were individuals who were making $13,000 as home health care aides. Some were unemployed, others were in other very low-income jobs. So we took people from poverty. They're now making $39,000 and are committed to working for the Health and Hospitals Corporation of New York City for 2 years. And after that, they can go on from there. It's sort of an honor thing in terms of working with Health and Hospitals Corporation. And they'll go on from there to make even higher salaries, actually, after they've sort of, in a way, paid back their scholarship, which is what we're hoping that most of them will choose to do.
That's very exciting. Thank you. So we now have 5 minutes for questions to Veronica. So if you can, make your question very quick, and she'll respond very quickly. Yes.
Hi, I'm Susan Jane Stack from Loudoun County Department of Family Services in Leesburg. And I would ask you, Ms. White, what effect do you think your New York City's kind of renovation of the poverty standard will have on the national, on the folks up the street here? Because I work in family services, and it's absolutely true. It's meaningless, poverty rate.
Well, for years, the Census Department has published on their website various alternative poverty measures that are very interesting to take a look at if you haven't, because they're across the board, very, very different and very interesting. And obviously, we didn't invent this on our own. We based our poverty measure on the report that the National Academy of Sciences brought back in 1995. Many cities across the country and some states have approached us and are very interested, as we are hastily working to put together the technical appendices so that we can actually do more technical briefings with individuals, are looking at what it is that we're doing. We're very interested in looking at that for their own localities and for their own states. In terms of what the federal government has for years obviously thought about these issues, and there's been much talk about it for, I guess, at least 20 years in terms of what people are thinking about. So I guess it remains to be seen, perhaps over the next few months, what direction that will take here in Washington.
Diana Pierce from the University of Washington. I'd like to ask about one of the results of your new poverty thing, poverty measure, excuse me. I think it's very good to have something that would reflect the impact of different transfers and income supports and work supports. However, the measure that you came up with based on National Academy of Sciences, I think is quite a modest improvement. It only increases the poverty level by a small amount, about 25%. You haven't published any of the technical numbers, so I can't be very exact. But it actually, the count of poverty also only increases about 22%. Many of the studies that are being done, like by the foundation, which uses 200% of poverty, the one that I've developed, the self-sufficiency standard, finds that the poverty rate at the state level is around 20% rather than among families. You actually found that the poverty rate among children of single-parent families actually went down a little bit with your measure because of the way you're counting resources. You didn't raise the poverty level to reflect the real costs in New York City because it's only a partial standard. So I wonder, there's a lot of promise here, but if we don't make a poverty measure that really measures what people need to meet their basic needs, we get a wrong picture of poverty. If you use a poverty measure that really measures it, then you find out most people are working, and that's where the problem is. You sort of alluded to that. But anyway, speak to the issue of the fact that the revision doesn't really change the poverty level very much.
There are many different ways to measure poverty, yes. I think probably everyone in this room knows, and some know much better than I do. The reality is that we decided to choose for our first measure to look at an income adequacy approach to see whether our programs worked or not. So for years, people have said, why does the federal government invest in EITC? Why is there a child care tax credit? Poverty doesn't change. We put all these investments into these poor families for years, and nothing has changed. There's still these horrible levels of poverty. We wanted to be able to have a measure, an income adequacy approach, and that's all it is. It's an income adequacy approach. It is not a self-sufficiency standard. There are many such calculations for New York City. They hover around $55,000 and $58,000 for a family of 4, which is far above our $26,000 that we just came up with the income adequacy approach. We think it's important to look at all different kinds of poverty measures. This is one particular approach, an income adequacy approach. which is based on the existing federal model, and it's just refining it, so it's bringing up taking both the threshold side and the resources side. So, for example, we're taking the tremendous cost of housing into account in this measure, and for the first time, we're looking at it in terms of New York City, and obviously the poverty level in New York City is very different than it is in other cities and other states because of the cost of housing in New York, and this is the first time that that's being taken into account.
Thank you, Veronica. So we'll have time for more questions to Veronica and all the panelists after everybody's done. But now let's move on to Greg Gray. Gregory Gray is a former state legislator, is the executive director of the Legislative Commission to End Poverty in Minnesota by 2020. The title of the commission sort of tells you what he's about to be talking about. So Greg, if you can tell us, how did this come about? Where is it now, and where is it going?
Well, the commission actually came about through the work of the faith community in Minnesota. About 2 years, the law that passed, that created the commission passed in 2006. In 2004, there was a group of about 30 faith organizations that came together to talk about the issue of poverty. From their gathering came this movement, really, in the faith community that we needed to address the issue of poverty. They contacted the then majority leader in the Minnesota Senate and a member in the Minnesota House, who then pushed a bill that would actually establish a commission, not just to look at poverty, not just to look at child poverty, not just to look at some other facet of poverty, but to look at poverty in general with the thought that poverty itself could be ended. To look at it with that goal in mind, and to look at it with the timetable of 2020. And I think both those aspects are important when you're dealing with legislators. They need a deadline, they need to know the scope, they need to have some general understanding of exactly what is being asked of them. And since this commission is comprised of 18 legislators, 9 from the Minnesota Senate, 9 from the Minnesota House, and then 2 appointees from the Minnesota governor, it was important to give them the parameters that they needed to do their job. So the commission was originally scheduled to have about 2 years, a life cycle from January of 2007 to December of 2008. And in fact, the commission did not start until June of 2007. So we've got about an 18-month period, or we've had about 13 months now to look at this issue. We were fortunate enough to really have some legislative leadership on the commission that realized that the typical hearing process was not going to be successful. To just have people come to the Capitol and testify about the demographics of poverty was not going to tell us what we needed to know. So we did that, but we also went out throughout the state of Minnesota doing what we called listening tours, to talk to people who were in poverty and talk to directly to people who serviced poor families. And I think from that, they really got a better sense of what poverty in Minnesota was like. They got a better sense of what it would take. And the fact that in many cases, those in poverty were harder on themselves than many of the legislative leaders would have been. That they took full responsibility in many cases for situations that in fact were not their fault. Or in fact, them being in situations that would have been difficult for any one of us to escape, whether that was a health issue, whether that was some family emergency of some type, whether the fact was transportation issues in rural Minnesota, getting from point A to point B and rising costs of gas. So from that, the commission came up with a list of issues, some of the key issues that we identified as impacting poverty. Some of those I've already talked about: transportation, health care, child care, economic development issues, moving people to jobs, or making sure that there's workforce housing so that people are near the jobs where they work at. And from that list of issues now, we're actually grappling with the ideal of how do we come up with recommendations that will move us toward our goal of ending poverty, of alleviating some of those issues that we'd identified. Now, in Minnesota, things are a little more difficult in the sense that we've done some of the things that Mark and others have talked about us having to do, whether that's a state earned income tax credit, what we call our working family credit, raising the minimum wage, a very significant sliding fee child care system. So now we have to move beyond that and actually identify some innovative approaches that we haven't already tried to move us that additional margin.
Thank you. So in starting out, as you know, in a number of other places, the goal is half in some period of time. Minnesota has been more ambitious than that. So tell us, how did the decision come about to focus on a goal of ending poverty, and what's been the experience so far as to how that affects the conversation?
Well, first of all, had the legislature been the ones who actually were the motivating force behind this, you're absolutely right. It would have probably been child poverty, and it would have been cut child poverty in half by some particular point in time. People would look upon that as politically safe. They won't catch a whole lot of flack at home by talking about children. But the motivation for this was from the faith community, and their attitude was, we have to look at poverty in general. We have to look at all poverty. And as others here will, I'm sure, talk about, you really can't even address the issue of child poverty without recognizing that those families where those children live also have to be looked at, and we have to have policies that address them as well.
As we'll hear from Connecticut in a moment, where Connecticut has focused on child poverty, bringing about cutting child poverty in half would be quite an accomplishment in itself.
Yes, it would.
But,
no cut on Connecticut.
But now, specifically with the goal of ending poverty, one of the issues that comes up when people talk about taking on an initiative at the state level is how much can the state really do, and aren't large parts of this dependent on the economy, and aren't large parts of it dependent upon the federal government and its choices. So what's the dynamic of the state taking this on?
Well, the commission is looked upon, it looks at recommendations very broadly. Specific in the legislation, it says that we're not looking solely at state government, and that in fact we recognize that state government itself alone cannot do this. So we're looking at the faith community, we're looking at the nonprofit community, we're looking at the federal government. There'll be recommendations that deal with county governments. We're looking at this very broadly in a way that hopefully brings everyone to the table, because that's what it's going to take in order for us to make the kind of progress we want. I might also add, too, that when you look at Minnesota's numbers, we're doing very well. When you look at them in total, I think we have the 8th lowest poverty rate in the nation. But we have significant pockets of poverty. 1/3 of the African American families in Minnesota are below the federal poverty guideline. 1/3, over, I think it's almost 60% who are within 200% of poverty. That should be legislators should be outraged about that, but often they don't know. And so we're trying to inform them of that.
So in a situation where the racial disparities are as enormous as they are, how does that affect how the commission thinks about its work?
Well, there are two different schools of thought, frankly. There are those who look at it from a political standpoint, that to talk and focus solely on the disparities, which bring up the issue of race, which in Minnesota we don't like to talk a lot about race, but it brings up those race and gender issues that are very complicated for folks to talk about. Politically, they sense that will eliminate the coalition of policymakers that are necessary to move the ultimate legislation. So we tend to focus on those things that tend to try and bring folks together around the issue of poverty, whether the fact that urban poverty is about equal to rural poverty in Minnesota, the fact that more whites, in fact, overwhelmingly more whites are in poverty than African Americans and others. So those are the kind of things that we grapple with. How much do we focus on the disparities? how much do we focus on the broader picture?
Thank you. Let me throw it open to the audience for questions to Greg about the Minnesota experience.
Hi, my name is Allison Johnson. I'm with Sojourners, a Christian organization that works to mobilize the faith community on the shared goal of ending poverty or having poverty in the next 10 years. And I'm wondering if you could share maybe some lessons from working very closely with the faith community in Minnesota and maybe some best practices for people who are motivated by their faith to work on this particular issue but don't have necessarily the legislative experience or connections, relationships, those kinds of things. So.
Thank you very much. I think that's an excellent question, first of all. And faith is a powerful force, and the faith community, therefore, is a powerful driving force, not just in Minnesota, but around the country. And in part because they speak to both sides of the aisle very easily. All the faith traditions basically speak at some point about poverty and about our responsibility as individuals and collectively to address the issue of poverty. So by mobilizing the faith community, often you can raise the level of conversation beyond the partisan conversation that we typically have in the legislature. And as I said earlier, this bill passed with overwhelming bipartisan support, in part because the Republicans who controlled the House of Representatives and the governorship had this close relationship with some of the faith leaders, in part because the nonprofit community, which was also active in this, had a very strong voice with Democrats. And so blending those two together, the social services agencies, the nonprofits that have traditionally focused on issues of poverty, along with the faith community, was a very powerful factor in us moving forward on this commission, and continues to be a motivating factor. Every time I reach a dead end, frankly, those are the folks that I call because they can put in the phone calls to our governor and others that can usually move us beyond the impasse.
Great, and I'd like to not only address this question to you, but I hope the other two speakers will also address this issue. I found it interesting that you've now been so fairly successful in Minnesota, you're not sure where to go next. If you're completely successful and eliminate poverty, you'll put a lot of social service person and clinicians like myself out of work. My question to you, and I know, having lived in other cities, your population in terms of Minneapolis, Minnesota, where you have probably a larger white population than African American, and I would like to know what the impact in Minnesota and also for Connecticut and Illinois, the impact of the NAFTA-GATT treaties outsourcing of work, which the person from New York didn't address, but when you're talking about employment for low-income, perhaps low-skilled workers, we're talking about jobs at $7-8 an hour gross. So what has been the impact of the NAFTA-GATT treaties outsourcing and illegal immigration in Minnesota and other states as it impacts employment and benefits and bringing yourself up to being able to afford to live today? Thank you.
Well, certainly NAFTA-GATT has reduced, in particular, some of the manufacturing jobs, that base of jobs that used to exist in Minnesota. A lot of those jobs have left. We're far more of a service-based economy than we used to be, and that all means that folks are making less money. We can't fight the battle again. I know there are others in this room who are going to fight the battle to try and move us away from that. Personally, I don't know whether we can win that particular battle. We can make sure, though, that folks who are in the new economy, who are in these new jobs, receive the benefits and the wages that are necessary and the supportive services that are necessary so that they can provide for themselves and their families. And I think that's what our goal is as a commission, to make sure that we stabilize those families and make sure that they have an opportunity that allow them to participate fully in the economy.
So let's now move on to Connecticut. Talking about the Connecticut situation will be State Senator Jonathan Harris. He is the chair of the Senate Human Services Committee in Connecticut, previously the mayor of West Hartford. Connecticut, probably of all the states involved, has the longest period of engagement in this new stage of addressing poverty, beginning back in 2004. So we've asked Senator Harris if he can talk with us about how it came about, where things are now, what has evolved over this time. So he has a lot to talk about, and he has hopefully a PowerPoint to aid in his quick overview.
Thank you, Mark, and thank you to the sponsors and to Jody also and CLASP for helping us out, and for all you for coming and for everything that you do in our communities. I will try to sort of encapsulate some of that progress in the first 5 minutes and then maybe get into some of the other pieces. It came about because of two factors, really: moral outrage at poverty issues and fiscal necessity. And when you take a look at Connecticut, by many measures, per capita income, for example, we are the wealthiest state in the nation. We duke it out with New Jersey occasionally, but we are up there. And we found that our poverty rates, child poverty and overall poverty, were high and were increasing. We always talk about having two Connecticut's, the wealthy, shining city on the hill, and literally right next to it, places where I was born and grew up, have severe poverty. When you took a look at the trending of the statistics, kids living in households of 100% or less of the federal poverty level, even from 2003 to 2004, during good times, it went up from 10.1% to 12.4%. Snapshot of 200% of poverty and below, it went up from 23% of all kids living in those households in Connecticut to 23.9%, so nearly a quarter of the kids. Our capital city, which we take a lot of pride in, Hartford, in 2006, had a child poverty rate of 43.4%, and that's trending up. Nearly 1 of 2 kids in Hartford is living in poverty. Our other major urban areas are all within the top 75 of impoverished cities in the state of Connecticut. And so people had moral outrage about this, but it also became very clear as we try to remain competitively within the region, within the nation, and work together on global competitiveness, that we were losing a huge amount of productivity. It was estimated that about at the 10.1% of child poverty, that first statistic I gave you, Connecticut was losing over $1 billion of family productivity a year. $1 billion in a time where, when we over-rely on the property tax, which is a whole other story we can talk about, and have a tremendous competition for resources, we were going backwards, not forward. And I have a couple of slides, and there's a PowerPoint that's going to be posted, I'm told, and there might be hard copies around, but I'll show you 2 of the slides. So we embarked with that moral outrage and fiscal necessity on a journey back in 2004. And the first thing that we did was pass legislation which required the reduction of child poverty by 2014, within 10 years. Now, we talk in terms of child poverty, but we all know the backbone of getting rid of child poverty is having adults, parents, families that are working. So it really is a much larger brush, and you'll see that from the presentation. We created a Child Poverty Council that has an annual report that's required so that we take up-to-date snapshots and have information on our progress. And we combined this Child Poverty Council with a Prevention Council, which actually was something that it took a little bit more effort than you'd think, that, wow, we can actually deal with things on the prevention side to try to help on the crisis management side. Let's nip this in the bud. It took a lot to actually even get that done. We brought in, the council brought in, experts, national experts, to review 67 recommendations that this Poverty and Prevention Council put on the table. Mark was one of those experts. And those experts used an analysis that said, give us something that's evidence-based, give us something that's cost-effective, and something that can be done, achievable within a relatively short period of time by 2014 with a very ambitious goal. And they actually boiled those 67 recommendations down into 4 general areas and 13 more specific areas to work on. There was target populations that were selected, and you can see it goes beyond just children that we're trying to target to deal with this problem. Very importantly, and this matches a trend in the Connecticut State Legislature, moving away from siloing agencies and groups not talking to one another. We moved towards a model of budgeting and have applied it very strictly in this area called results-based accountability. And this is providing the model for contracting related to poverty reduction. You'll see in some of the materials that you've been handed out how that particularly works. We voted to create actually an economic model. And right now, if anyone is interested, we have an RFP out due by August 7th for a consultant to take a look at the 67 recommendations and the 13 specific areas and give us economic modeling that we can use to go forward. And finally, and we'll talk about this I think in the questions, is that we have found a new underutilized source of funding, federal dollars, the Food Stamp Employment and Training Dollars, FSET, which I think might be called SNAP and maybe SNAP It as of October 1, so we'll have to change our nomenclature. But to, one, get buy-in, and also, most importantly, to help fund, especially in difficult times, these efforts.
Thank you. So let's just pick up with the discussion of the food stamp employment and training, because one of the issues that every state faces in this process, or a city faces, is the question of if we're going to do something new, how do we pay for it? So could you tell us a little bit more about what the legislation is and what you envision happening under it?
Yeah, first of all, we'll just give you a brief description of FSET. It's the uncapped dollar match. It's actually, we've turned a 50% return on dollars, but we'll call it a dollar-for-dollar match on a broad range of employment and training services for food stamp recipients. It's actually administered as a cost reimbursement program. So private sector, local government, state government puts a dollar down, they're entitled through an agency to get a match back from the state government, which then they can use for a broad range of services. Some of the services, well, first of all, the funding, again, state and local dollars, private sector dollars can go to this to generate the match, foundation dollars, employer contributions, tuitions at colleges going for these specific amounts can all generate the federal dollars coming back into the state. And the allowable costs are direct and indirect costs that are attributable to training food stamp recipients, to giving them education and employment training. It can be just general education costs, GED costs, English as a second language, supplies for school. There are training dollars, job placement, case management, career coaching, re-entry programs for people in prison. Needed items, you can use it for clothing so people can present themselves to go to work appropriately, transportation, housing, child care. As long as it's within what the state says and within a broad set of federal guidelines, you can use these dollars to come back, including the administrative expense of overseeing the FSET program. That can be used. So very flexible. New York, actually, in 2005, I think had about $47 million of these 50-50 match funds coming back in the state. A small state, Vermont, had about $2.2 million coming in. So you can see it's very powerful. Our FSET bill that we just passed builds on what I described from 2004 and tries to kind of put everything together in a targeted, consensus-based, expert-driven package and wed it to the funding. What it did, and you have the handout that will give you more detail, is it specifically defines poverty reduction strategies so that everybody is on the same page. State government, local government, private sector, all on the same page. We directly link the Child Poverty and Prevention Council's plans, those recommendations and the specifics I talk about, with the FSET dollars. And we define and give incentives for community collaborations. One of the things that we didn't want was to get the money back but have sort of this lone wolf type of mentality where you had an FSET generator just doing their own thing. We wanted to make sure there was community-wide coordination and that even entities and individuals that could not specifically generate FSET dollars would be able to take advantage of the funds to have a community-wide program. So what we did is we had the Department of Social Services, which administers this program, actually give priority to providers who are members of a collaborative, and we define what a collaborative is, and whose strategies are in line with the recommendations and policies of the Child Prevention Council. When the money comes back into the state, the department administers it. It peels off 75% of the money after taking away some money for their administrative costs, so it's a no-cost item, help big on the buy-in. They take 75% of what's remaining and give it back to the FSET generator so that there's incentive to keep the funds flowing back into the state, and 25% goes spread out to the collaboratives to help fund both the FSET and the non-FSET generators in their community-wide collaboration.
And I suspect there will be more interest in this from other states, both because it's providing a funding stream and because it's providing a way to expressly generate funding for localities, for the collaborative efforts, and because of its engagement of non-governmental entities in this process.
Yes.
So let me turn things back to the audience for questions on Connecticut's experience. I've got a lot, but go ahead. Yes?
When you do these programs or grants and stuff, there have to be outcomes, and there have to be numbers for accountability, like in New York. There are, I believe, clearly defined guidelines and criteria to show whether or not your program is successful so that you can get refunding. What are your outcomes? How many out of, and not percentages, because you could have 95%, but only 10 people participated. So what are the numbers of the successful outcomes of your program, whether in Connecticut or anywhere, New York? That's what I think people need to see, rather than have continual duplication of services of all these programs wanting more federal, state, and local dollars.
And let me actually just broaden that question so that you both talk a bit about the results-based accountability, but then also situate that within your overall goal of child poverty reduction and the state's progress so far.
Well, I think that it's a very good question, and I think that the real answer is in the results-based accountability. We actually specify in the statute that in order to be able to receive the funding and to participate in FSET and to measure the outcomes of the poverty reduction efforts, we're using this template. As far as specifics as to what those numbers are, we are just now working on the results-based accountability template that's going to be applied to this program. So there are no specific numbers that I have yet within my grasp, except for the outline of what we're working on as to how we're going to measure the outcomes. But the basis of your question is very important, because it is all going to be population-based and outcome-driven. We are doing this across the state budget, which we had 0% of our budget using RBA as of a couple of years ago. We're now slowly but surely approaching 5 to 10% of our budget, with the goal to actually spread that throughout our budget. So the answer to you is that there are no specifics yet, but they are being developed, and you should stay tuned.
Yes, here we go. A couple of the comments made thus far prompt this question from me. One of them was about the point made that the key to reducing child poverty is for the adults to have jobs. And the other one was a question earlier about the impact of NAFTA. I'd like to ask a question on a different angle on this. And the question is, has anybody been collecting data that looks at the impact of employment, unemployment, and underemployment at the local and state levels of offshoring? When states offshore contracts to deliver services to save money on the specific contract, is anybody looking at whether or not, in fact, that may be increasing the demand for social services, and to figure that out through a better understanding and profiling of who is applying? I mean, it seems like the data could, here is a case where the data could be collected. When someone applies, you can find out what kinds of jobs they have had, what their skills are, what their training are. And I can't believe that the local and state governments don't care, but I have a sense that the data probably is not easily available, and so no one's really comparing that.
In Connecticut, we have taken efforts outside of this context, just in general, through our contracting reform, to actually take a look at the offshoring issue and the effect on our job force. And as a matter of fact, there have been several stronger bills around, and it takes a couple years for things to pass at times, that have actually will require state dollars to go to companies that are doing business within the state to ensure that we keep those good jobs attached to our state contracts in our state for our citizens.
Thank you. So let's move on to Amy. Amy Reinell is the director of the Heartland Alliance Mid-America Institute on Poverty. She is also the director of the Transitional Jobs Network. In Illinois' situation, as she's about to tell us about, legislation has just been voted on by the legislature, awaiting the governor. And Amy, if you can tell us about what the legislation is, how it came about, and your observations based on that process.
Thank you. And thank you all for coming to spend time on the issue that I've essentially devoted my life to for the last 2 decades. So I think it's so important to hear these conversations about what's happening at the state level, because we're learning a lot. We've learned a lot, actually. It's been very interesting. So thank you to the organizers. We have been working on essentially a poverty education and legislative leadership campaign for about the last decade. We release an annual report on Illinois poverty, which really breaks it down. It gets data for every geography in the state along a wide range of poverty indicators. We release it to elected officials, and we have a core group of leaders that help us prioritize where we're going to invest our advocacy and policy leadership each year. We've had tremendous amount of success. A state earned income tax credit was created. We have preschool for all kids. We have health insurance for all kids. So we had made a lot of progress until recent years, where our state budget crisis became quite dire. We have a structural deficit in our state budget and a political stalemate around who has power to influence that process. So as we thought long and hard about how we can take our state to the next level of addressing poverty, we decided to invest into 2 different strategies. The first was to create a campaign. We created a campaign entitled From Poverty to Opportunity, Realizing Human Rights in Illinois. A goal of that campaign is our second strategy, which is to create a commission on poverty for the state of Illinois. So we, as part of those initiatives, have done things like held community forums called From Poverty to Opportunity Action Forums. About 22 communities across our state. Illinois is very diverse, a large urban area, many small urban areas, a tremendous amount of suburban poverty, as well as rural poverty, so we run the gamut. So at these forums, we had elected officials, local as well as state level, and sitting next to people who are poor, sitting next to service providers, really strategizing on what barriers in their community are standing in the way to opportunity and what solutions would make a difference for them. So we held this process last year. We initially had thought we would launch our work on the commission a year ago, and after interviewing a number of groups around the country, realized we needed a broader political base. Our political stalemate required louder voices. So through this forum process, we did an endorsement campaign. We've had over 1,500 people in the state endorse a goal of cutting extreme poverty in half by the year 2015. We've had 225 organizations sign on, which is a really large number for a state-led initiative to have so many entities sign on. We've had people endorse this campaign, from someone who grew up poor to the mayor of Chicago. So very diverse range of stakeholders. To date, in terms of our legislation, we just passed both the House and the Senate unanimously. We had almost half the legislature co-sponsor the bill, and a lot of that was media coverage. It was local people coming to them saying how important this is for their community, as well as a lot of the uncommon legislative leaders we've built. A suburban legislator fighting for this, rural legislators and others, not just Chicago. So I think it's been we've been building a broad base, building leaders towards this goal of having a commission that will create a poverty eradication strategy with benchmarks along the way.
So Amy, many of the other efforts are focused on poverty as opposed to extreme or deep poverty. And often the conversation is about saying even focusing on poverty is setting the bar too low because the poverty line is so low. So what led to the particular focus on deep or extreme poverty, and how does that affect how things proceed?
First, I think I should define it. I forget sometimes to define it. Extreme poverty, or deep poverty, as some people call it, is essentially living below half of the poverty line. So that would be a family of 4 whose income is around $11,000 a year or less. We chose extreme poverty, I'd say, for 4 reasons. The first was through our annual tracking of poverty and other indicators in Illinois, we noticed that people in Illinois were getting poorer. So poor people in Illinois were getting poorer. There was also, at a similar time, a national study released that showed that the average individual in poverty in the U.S. was falling about $3,200 below the poverty line. The average family, about $8,200 below the poverty line, the largest gap by far on record. So we saw this growth in that part of our poverty population. As we started, in just the work we do in the state, asking around about it and meeting families, the second thing that I think triggered it was the urgency of the hardship. I have met families living within an hour of Chicago in dirt floor shacks. I've met people who can see the skyline of St. Louis from their backyard and they don't have sewers. People in rural areas whose wells, that's their only water source, are polluted from agricultural runoff. Sort of conditions I think we don't expect to see in the U.S. in a very rich state. Families whose kids are wearing clothes that are way too small and weather inappropriate because they can't afford to keep buying new clothes or even used clothes as these kids grow. So there was an urgency that I think drove us to that. The other 2 factors were perhaps more practical. The first is policy solutions. We can target some policy solutions to that group and know that we'll see progress. So one of the important parts I think that we see with this commission is it's a standing commission. It will update its goals regularly, and so extreme poverty we see as the first goal. So we want to be able to achieve the goal. And then finally, there's a body of international work around this called the Millennium Development Goals that was adopted by the UN member states in 2000, and one of the goals is to cut extreme poverty in half internationally by the year 2015. So we're drawing from a number of different directions.
So your legislation has passed unanimously. Why wasn't there controversy?
We've been working on this for a long time, and we use a lot of different strategies to build political will. We do what we call a freshman legislators briefing every time there's a new election, where we brief them on poverty and hardship. That's all we do, and we're essentially trying to build them as leaders. All of our data is localized. We have done our best to make this a local issue for legislators so that they have buy-in. We did an analysis of the counties and legislative districts with the highest rates of poverty and extreme poverty, and when we were sensing people wavering, the sponsors of the bill would go show them the data in their district, and they'd say, they were held accountable right there at that moment around the people in their district suffering. So that was another piece. And then the final piece is using really intentional communications mechanisms. So we do a tremendous amount of media work. Our goal is to get media coverage on poverty in every legislative district every year, which we've achieved for about the last 5 years, and then we send that media coverage back. And it's gotten to a point where we've worked with these reporters so long that these are in-depth stories. They're front page stories, they're above the fold stories, they're 5-day series. So it's not a small business sort of thing. We've really thought a lot about how we get the local legislator feeling the issue locally. So I think that's part of why we haven't gotten as much pushback as we had earlier, a decade ago.
Thank you. Let me throw it open to the audience. Questions to Amy? Okay, make your questions really quick because there are a lot of them. So yes, over there.
I wonder if any of you can comment on the role, if any, of family planning education and even possibly the distribution of condoms to prevent the spread of HIV so that children will not lose their parents so early in life.
Have Amy respond now, and then we'll have some more general discussion in a little bit of this and other issues.
I am not an expert on youth anything, but I will say that we do know just from data over time around triggers of entry into poverty. If you're a teen that has a child, you're almost guaranteed to experience poverty. So helping teens understand the economic consequences of their actions, I think, is really important. I think there's a broad range of literature that's growing around the best ways to help youth make decisions that will enrich their lives, but I'm not in any way an expert about that.
Questions in the back.
Hi, I'm Fran Bernstein. I'm with AFSCME, American Federation of State, County, Municipal Employees. And this probably affects all states, but in particular in Illinois, we know that with state budget crises and other issues that the public delivery systems for income supports has been cut back dramatically. We know of caseworkers in Illinois that have 1,000 cases, and that obviously affects what kind of delivery that they can give to their clients. And I'm just wondering what your organization and your campaign has done to address that issue, and I don't know if other folks on the panel have done that as well. Thanks.
We actually have a broad range of policy initiatives within my group, and one of them is entitled Access to Income Supports. And we've created a task force that was headed by the 2 state agencies that play the biggest role in delivery of income supports. We have fantastic laws on the books in Illinois. We're a public policy study in many ways about good public policies to help people who are poor. The problem is our state budget has really tied the hands of many in delivering the good policies and the good services. So this task force met with experts for, similarly about a year. We produced a document of recommendations that's now going to be given to the legislature to start either passing laws, arm twisting, investing dollars differently to improve access. Things ranging from use of technology to better training for caseworkers to lower caseloads to a no wrong door approach. So it's a serious issue. We have so many people eligible for benefits who aren't getting them. And so one of our main strategies at the moment is to maximize what we have and help people get it.
One more question, yes?
Thank you. Jill Cunningham with Fourth World Movement, international organization taking a human rights-based approach to eradicating poverty. So thank you, Amy, for all the work and references and for bringing a face to a little bit when you talk about having met families that are living in a dirt shack and the I believe you called them community forums where people in poverty are sitting with state legislators and speaking. I'll ask you this question, but I have a question in terms of evaluation for the entire panel, and at what point people in poverty themselves are part of that evaluation. And so for Amy, when these laws get passed and the coverage gets in the newspaper, what's the mechanism for having that go back to the people who help contribute to that? And can you speak to that a little bit?
In the legislation, we have written in that 3 of the seats will go to people impacted by poverty, 2 specifically for people who are poor, and the 3rd for someone with a disability who's poor. When we looked at who's living in extreme poverty in Illinois, there are 700,000 people. I don't know if I said that. About half are children, elderly, or people with disabilities. So we want to make sure that their voices are well represented within the commission. With the action forums, we released a report of the voices. We have a blog, and we have other ways that people are weighing in. They're writing their stories. They're doing their stories audio and visually. And then I envision that there will be a lot of opportunities for people to go meet with their elected officials as we move down this path. Currently, people are weighing in on who they think should be on the commission. So this broad base of people who have endorsed the campaign are continually feeding in how we prioritize some of the decision making.
Okay. So let me ask each of the other panelists if you'd like to comment on ways in which individuals who are poor are engaged in your process and how their voice is part of it.
Certainly in Minnesota, that's an important part of what we're trying to do. Since we went out on the road to talk to folks on the front end, we feel a commitment. Once we come up with tentative recommendations to basically vet those recommendations against those same communities. So we'll be on Indian reservations, we'll be talking to low-income families, we'll be meeting at many of the same places where we went on our listening tour to get that feedback and find out areas where we may need to make some corrections.
In New York as well, what we've done is, in creating and formulating the programs, is meet with potential participants in the program to see what their concerns were. It's not like we're building on something that didn't exist. So, for example, it was easy to go to the Department of Juvenile Justice and to ask the young boys and girls who are 13, 14 years old who are in these facilities and are not in school, and discuss with them in closed forum the kinds of programs that were existing, what we could possibly do to help them, what they found they thought would be very useful, and the kinds of issues affecting them, and they thought that CEO could provide. And we started a small program, for example, in DJJ with that, the Juvenile Justice Children. Many of our programs are formulated in cooperation with people that would be potential participants. And then similarly down the line, we are doing surveys for our evaluation purposes, most more anonymously, in order to evaluate the programs, to find out whether or not it had impact, what kinds of things happened, to evaluate the impacts, and also take it to a more personal level in terms of just different ways the programs run, whether the community-based organization running the program was eager, facilitated things well, just questions of respect, all kinds of issues that we're trying to evaluate in different levels and ways that we're doing the surveys for our programs.
Through the general legislative process, we've actually been fairly successful in Connecticut at having people that are impacted appear and testify at public hearings, which is a wonderful thing to be able to have that involvement. We also have good involvement through the Commission on Children. I want to say that the Commission has been up and running for years now and has been key in the poverty reduction and in this FSET effort that we put on at really pushing things forward, making sure the information's out there, and getting feedback from those that are impacted. Also through members of the Poverty Council, both directly and indirectly, we're getting feedback on where we need to go and the impacts of where we're going. And finally, Connecticut has actually a Connecticut Parent Leadership Training Institute in 14 cities. So there already is a built-in network for two-way communication on what we need to do and the impacts.
So let me then invite panelists, anybody who wishes to comment on this. Several of the questions asked either about offshoring or outsourcing, or more generally the current economic situation and the ways in which it impinges upon opportunities for a much broader group of people. I would welcome anybody who would like to comment on the relationship between your poverty reduction strategies and the state's broader economic development strategies, workforce development efforts, how you're tying it to the overall economic conditions. And I know it's a very broad question.
New York's larger.
Yeah.
I guess I'm not sure whether I speak for Mayor Bloomberg, with other New Yorkers in the audience, if you tell me, but globalization is here, and I think that I've heard him say similar things to that. So I think what we're trying to do in New York, and we're working with most particularly our small business services and our community colleges, in looking at where are the jobs of the future, and how can we train people now, how can we give them the proper education so that they can have a job 2 years from now, 5 years from now, and 25 years from now, and what kinds of education do people need, and what kind of technical skills do they need, and where are the growth sectors in New York. And we're doing a lot of research around that, particularly with our small business services department. We're also very focused on trying to make sure that people get a college degree. We know that getting a high school degree cuts your chances of being in poverty in half, and every year thereafter in college cuts it down tremendously. And one of the programs that we've created with our community colleges, all 6 of them in New York City, is to recruit people to our community colleges. And instead of, for example, myself teaching nonprofit law at 8 in the morning and someone else teaching how to be an assembly person or a state senator at 6 at night, or the way that community colleges are run across America, which is often run by adjunct professors' schedules, what we've done is we've created the schedules for the students. And so the classes are offered from 9 to 12, the classes are offered from 2 to 5, the classes are offered from 6 to 9, or even on just Saturdays and Sundays. Because we know that people do need education, and we know that many people who are poor need to work and do work and have families. And so we are doing as much as we possibly can. We've started a pilot program for 1,000 students. We recruited 1,132. And we're trying to get as many people as possible through the community colleges and providing the types of education that they need in order to get out of poverty. That program is commencing its second year. It's obviously the students started last year in September, just months after we started the center, and they're entering the second year of the program this fall. And we're very anxiously looking forward to how we can expand that program if it works. We're providing tutoring, help with getting into four-year colleges, as well as making sure that the classes are all, the students go through as a cohort. So there'll be 25 people going through as a cohort that reinforces each other, and that the classes are scheduled at the times that are useful for the students so that they don't have to choose between their job, which many of them have, their children and their child care schedules, and their academic work.
Well, I had addressed the offshoring issue more specifically. As far as just workforce development, it's directly tied. I mean, the whole focus on the FSET piece involves employment and training and getting people back to work and being self-sufficient. And that dovetails hand in hand with our other workforce development efforts that we're doing in the state. With respect to just the general economic situation, actually we were able to use that to our advantage this past session, because we were able to identify those federal FSET dollars and come up with a no-cost way to be able to accomplish some of our goals. We were able to get a tremendous buy-in from both the moral outrage and the fiscal necessity side that I talked about, and those of us in the middle that feel both. And this bill, which not only helps to get the FSET dollars back, but essentially embeds and codifies this state and community-based strategy, passed the House and Senate unanimously. As a matter of fact, of the 100 votes cast in committees, I think there were only 5 against it, even in the committees. So we were able to get buy-in on our entire program, in part because people were so receptive to trying to get dollars in at a time when the state budget was so strapped. We started the session in February with about a $350 million surplus, which was shrinking every day, and we had a deficit by the time we adjourned Sine Die in May. So that's why we were able to do it this year.
We're very close to 2 o'clock. I think we've got time for one more question. Quick question, quick answers. Yes.
So we have to raise wages for the people who don't have the option of raising their own wages, and I think that's a fiscal necessity that I'm sure you all agree with. Part of the problem we have in any field, public relations, politics, or whatever it is telling stories, journalism and so forth. And so I was really struck by Mr. Gray's comment and about the people in poverty who are angrier than the legislators. And so I think that I'm fired up, so I hope you share that with Barack Obama.
Yeah, Barack Obama hasn't contacted me yet, but I'm certainly willing to take his phone call. And you're absolutely right, though. I mean, ultimately, as a former legislator, I know that the motivation for this has to come from the general population. It has to come from people finally being angry enough at the current situation where they prod their legislative leaders, their congressional leaders, to take the kind of action that many of us are going to document in reports. We want to make sure that those reports don't just end up on a shelf, as I'm sure many of you who are working on the same issue. And that's only going to happen when we redefine what this problem is in a way where people understand how important it is that everyone participate in this economy.
I agree with Greg 100%, except there is also a need and room for bold leadership from the top. One of the jobs that I had as mayor, that I have now, but the biggest things that I do is getting out there and talking to people and educating people. Since I'm immersed and they're not necessarily immersed, they might understand that there could be a problem, but with respect to how to get rid of that problem, they don't have that. It's not part of their daily lives. So that what we really need, and this will not work in a state like Connecticut where we have a 17th century process attacking 21st century problems, until we have, probably from the executive branch, given the constitutional imbalance and the bully pulpit of the governor's office, but in general, leaders that are willing to get out there and actually risk some short-term political success but do the right thing that will pay off down the road. And it's going to take some people willing to risk some things.
So, and just to underscore then, there are exciting developments proceeding in states and localities. There is much that they can learn from each other. They need a federal partner, and we hope that there will be one. So let me thank the co-sponsors, Half and 10, Spotlight on Poverty and the National League of Cities. Thank all of you, thank the panelists, and we look forward to continuing discussion. Thank you.